This is Nevada Cancer Coalition's Cancer Talks, a public health podcast where we connect with coalition members and partners to learn more about cancer prevention, early detection, and survivorship. Hear about cancer care in Nevada and meet the people who are making an impact. All right. Awesome. Thank you. I'm so glad to finally meet you.
Yeah, sound good. Well, my name is Ali Khalaf, and I am a cancer genetic counselor based out of Las Vegas. I'm currently working at Comprehensive Cancer Centers of Nevada, large community clinic where we have multiple different clinics here in Vegas. And then I actually service three of the clinics. So I kind of go around town servicing the needs of some of our oncologists. So genetic counselors in general, we are specialized healthcare professionals who are trained heavily in medical genetics and in psychosocial counseling. And so what we are able to do, for example, perform risk assessments, appropriately order genetic testing, interpret the genetic testing appropriate, to which then those results can be streamlined into specific patients' care, right? In a nutshell, we essentially help individuals, families, and even providers truly understand the physical, the emotional, and the psychological implications of genetic disease. So that's a kind of a general statement of what genetic counselors do. We practice in all forms of specialties. I myself am a cancer genetic counselor, so I focus specifically really with cancer patients or hereditary cancer testing. But we do work in, of course, cancer and oncology. We work in pediatrics. We work in prenatal, cardiovascular, essentially any specialty nowadays. Genetics is starting to become a part of it because we are starting to understand the genetic implication of people's genetics into their care, essentially. So my role mainly involves having individuals that either have cancer or people that have family histories of cancers being sent to me to be evaluated further for what we call hereditary cancer syndromes. And so that's kind of a high level overview of really what I do. And it really becomes a lot more specific depending on the actual clinical indication and why they're being sent over to me. But that's mainly what my day involves, day in and out, is evaluating people for hereditary syndromes, hereditary components, specifically in the oncology space.
So you mentioned that there's two areas, it sounds like, that genetics really impacts people when it comes to cancer. There's the hereditary genetics that would predispose them to cancer or increase their risk. And then there's the genetics that impacts their treatment if they're diagnosed with cancer. Can you talk a little bit about the first one, the not diagnosed, increased risk part of it? And then we'll move on to the other part.
Of course, yeah. So, ideally, we do genetic testing or we want to, perform genetic testing for patients, for families before they develop cancer, right? We want to identify who in the population is at increased risk of cancer based off their genetics so that we can be proactive with their care rather than being reactive and unfortunately just wait for them to develop a cancer, right? So most of the individuals that get sent over to me that don't have cancer from kind of outside clinics, right? Most likely going to be your point of care clinics, right? Your primary care clinics, your gynecological clinics, your community health clinics. They usually present with family histories that are a bit suspicious or concerning for one of these hereditary markers, right? Let's say a mom, a dad, a brother or sister who developed cancer, under the age of 50, especially specific cancers that have higher hereditary associations. Families that we just see a bit more cancer than we'd expect to see, that really makes us wonder, hey, what's kind of going on here? There's something that's really driving this family to have higher increased rate of developing these cancers. Even sometimes certain personal indications, right? Somebody who goes in for colonoscopies that has a bit more colon polyps than we'd expect to see. So just kind of certain scenarios that really make us question why this is going on. And whenever that happens from an outsider view, so not somebody who has cancer, that's when really a genetic evaluation is prompted to see if we can identify really what's causing these increased risk of cancer in the family. And from there, we're able to make more personalized recommendation. Our society has essentially created this one size fits all screening model for everybody, right? Go get your colonoscopy when you're 45, go get your mammogram when you're 40. And even with that, I mean, with the general screening guidelines, we're looking at about 3 or 4 organs potentially. And so what we have identified is that there are people who are at much higher risk of cancer that require more personalized approaches to their screenings. And they require, for example, enhanced surveillance. Maybe we need to start screening them younger. Maybe we need to start screening them utilizing different forms of tools. Maybe we need to start screening organs that we're not even screening at right now because, the general population risk of that cancer is so low that we don't normally screen that organ for people. So this really just helps us again create more personalized recommendations for those individuals that don't have cancer, as well as in certain scenarios actually recommending preventative strategies for individuals who are at very high risk of certain cancers, right? Individuals who are at very high risk of breast cancer, for example. Most people or some people are a little bit aware of that BRCA gene, the BRCA
Mhm.
gene, which we know causes extremely high risk of breast and ovarian cancer. And so whenever an individual has that genetic mutation, that genetic change in that gene, we usually make some pretty aggressive, considerations for preventative surgeries to really lower the risk of such individuals, such families, from developing those cancers throughout their lifetime, essentially. So
So
something
you mentioned the BRCA gene. Are there other genes or genetic syndromes that are a lot more common when it comes to cancer diagnoses?
Yeah, I mean, individually, every single one of these, genetic, so these gene changes that cause increased risk of these cancers in itself, I mean, each one had a different prevalence. The most commonly known ones are, for example, that BRCA one for breast cancer and ovarian cancer, and then the other most commonly known one and the most common one is Lynch syndrome, which is a
Mhm.
hereditary colon cancer syndrome. And for those two, the prevalence of those are pretty common. I mean, they're somewhere in the one in few hundreds. And so there are some that are a lot more rare, and there are some that are pretty common, along that same rate. But when you think about all of them as a whole, when you kind of combine all of these, I mean, they're pretty common. And there definitely are many individuals, unfortunately, walking around with these, higher risk markers that have no idea about it. And these are people in which we can implement certain things for them again moving forward to really try to lower the risk of them developing some of those cancers.
Yeah. So the other component of it is genetic testing once somebody has been diagnosed with cancer. So obviously that's not going to help set earlier screening guidelines for that individual. How does that impact them once they're already diagnosed?
Yeah, it's a great question, and I guess it really depends on the type of cancer they have, right? We're pushing into this model where it's becoming standard of care now for every single patient who develops breast cancer to be offered this testing at minimum, and every single patient with colon cancer as well. Specifically when it comes to breast cancer, for example, we really offer this testing for everybody, even if they don't have a strong family history or even if they're not, extremely young at diagnosis, because this helps guide surgical decision making recommendations for them. So we use this testing directly to determine what's their risk of developing a future, ipsilateral or contralateral breast cancer, just a new primary breast cancer. And so this is used directly for surgical decision making recommendations sometimes. There are actually certain targeted therapies that individuals could be eligible for if they do have a specific genetic mutation. For example, that BRCA gene, whenever an individual develops breast cancer and is found to have a BRCA mutation, they are eligible for a specific targeted therapy called a PARP inhibitor. A lot of individuals who have that Lynch syndrome, the colon cancer hereditary predisposition, usually they have this marker called microsatellite instability high, which essentially makes them eligible for a specific form of immunotherapy. And so, in those situations where those individuals already have cancer, and I know we're not really enhancing any surveillance for them at that point because our only priority is the current diagnosis, this still can give us insight of how we should be approaching their care moving forward. And ultimately, it's really just us being able to provide them as much information as possible so that they can make their own informed decisions of how they want to proceed with their care, so that we can hopefully give them the best outcomes possible.
I think it's just completely amazing that not only can you kind of help reduce someone's risk of cancer by getting them into screening earlier, but actually having guided personalized treatment based on this specific genetic signature of their treatment. You mentioned that there are people out there walking around that have these genes that can elevate their risk for cancer, but they're not getting tested. So what are the barriers that are historically kind of limiting access to people in getting genetic testing in Nevada?
One of the biggest things, of course, which is, I guess a good transition also to licensure and how helpful it has been, is number one, the field of genetic counseling hasn't been regulated. There has been a shortage of genetic counselors, of genetic professionals in general in the state. And so it makes it very difficult for, let's say, a community health clinic, a primary care clinic, or anybody who's doing this kind of point of care to have a person to refer to for this testing, especially when they don't have the proper knowledge or training of which tests to order, of which or how to interpret these results, of how to really incorporate these results into the patient's care. And so sometimes it's in combination of maybe a lack of proper knowledge of this testing, it's a lack of knowing where to send these people to. And so I think it's the infrastructure, unfortunately, in Nevada that's been a huge barrier to getting genetic testing. It's of course the lack of licensure that's been a huge barrier, lack of knowledge. There's also just, there's a lot of false information currently being kind of, not currently, but historically being kind of thought about when it comes to the cost of genetic testing. Genetic testing has become much more accessible, much more practical costs than most people think. And I still have people today that believe that this is going to be a test that costs them thousands and thousands and thousands of dollars, which is a very understandable concern. But after a more detailed discussion with me or any other genetic professional, of course, we're able to let them know and reassure them that that's not the case. That most of the times these tests are usually fully covered, especially for individuals who meet certain criteria. And even if it's not, usually have pretty minimal bills. So a lot of different things that really were big barriers in this state as of previously. But I think slowly, as we are starting to expand the genetics workforce here, we're starting to get more genetic professionals. Not too long ago, we only had, honestly, prenatal genetic counselors. We didn't have any cancer genetic counselors. We didn't have any pediatric genetic counselors. And so we were very limited in, the actual professionals who were able to do this. But we're consistently now advancing and starting to hire more individuals and really increase the workforce here to where we have individuals to where these community health clinics and primary care clinics can send off their patients to and be kind of reassured that they're getting the proper care and proper testing done for themselves, for their patients and their families ultimately.
And we have enough genetic counseling professionals in the state now that there's a association.
Correct. And we actually just formed that recently. So we just formed the Genetic Counselors Association of Nevada. We are still a very, very new organization. It is a few genetic counselors, after SB 189 got implemented, we decided to make this more kind of community resource for patients, for people, for providers to be aware of our services, to be aware of who we are and how they can contact us, and essentially just to make a more unified kind of community association when it comes to genetics and helping people understand where and how they can reach us and contact us.
So you mentioned SB 189. That's a great segue because I wanted to talk about that legislation. You'd mentioned it a little bit earlier as well. So tell us a little bit about that bill. What is this law?
Yeah, so SB 81189 essentially was implemented, which allows for licensure of genetic counselors, right? So previous to this, genetic counseling was not a licensed field. And essentially what that means is that it means a lot of different things, right? So there was a lot of, and this kind of goes back to the barriers of why genetics hasn't been so easy to get in Nevada. One of the biggest things is that it makes us, first of all, an actual licensed profession, and it creates genetic counseling as an actual recognized and a reimbursable service. And so a lot of times insurers or these payers would not pay for genetic counseling because we didn't license the profession, and they just weren't sure of how they're going to be able to reimburse us for the services. And so this essentially creates genetic counselors to be actual recognized providers, such as other healthcare providers, which will ultimately, in a more downstream effect, allow for insurance reimbursement, which can help eliminate, some out-of-pocket costs and essentially just allow for more of an equity outcome because more clinics now actually are going to have financial incentives to hire genetic counselors, right? Because they can actually bill for our services versus not being able to bill for our services. Ultimately, it's going to help expand the workforce. So now the in-state workforce of genetic counselors. So it creates more of a licensure. SB 189 creates more of a formal pathway to practice. And so what that means is that before SB 189 was created, technically anybody could have called themselves a genetic counselor. anybody with literally no training or not even in the healthcare field could have technically called themselves a genetic counselor. Whereas in now with this licensure, just as of course with any other healthcare provider field or any field, for example, it actually requires credentials, certification. It's going to allow for more oversight, and more standard of care. And this really comes down to being able to improve the quality of care that patients are going to get, plus also protecting them from kind of getting inaccurate information, which unfortunately has been going on for some time, right? It essentially just allows for the prevention of exploitation, and so that patients truly are getting accurate and real genetic information from people who are highly specialized in this system. And so before SB 189 was implemented, essentially it was just kind of blocking access to a lot of genetic services. It was creating a lot of different gaps, especially when it kind of comes to telehealth and telegenetics and being able to try to increase access to these patients in maybe more rural areas of Nevada that don't have a genetic counselor next to them, or that are too far to drive to one. So it really just ultimately improves access, it improves outcomes, it improves every form of equitable outcome that you can have to really expand genetic services in our state, in a state that very much needs it. And hopefully we can continue to expand now with this and bring more professionals into the state, to fill in the gaps that we still have and hopefully can work on through time.
Yeah, I'm so glad that you mentioned the equitable access and telehealth. So genetics, genetic counseling is something that people can get via telehealth, right? Yeah. So ultimately, people in rural and underserved communities that maybe don't have a primary care doctor nearby or don't have a cancer center or cancer treatment, they can access your services.
100%. So, and we are kind of working on that, as of right now, being able to even expand it a little bit more. But for the most part, yes, genetic counseling is a process, it's a service that could be done ideally, and it is done a lot of times fully virtually, right? I mean, we're able to see these patients virtually. We're really able to expand access to these patients that have, a variety of different reasons for why they can't come in, of course, to the actual clinic, whether that be a geographical barrier or some form of transportation barrier or whatever it is for that exact reason, to really help these patients, get the information they need, and to get the testing done that they need so that they could finally get the answers that they have been searching for, right? And so we have unfortunately been working, or previous to not too long ago, there has been some telehealth kind of limitations, and we had to stop it for quite a while just due to some legislative issues. But thankfully that got removed, and now we're back to being able to do telehealth, and we are actively working on really expanding that aspect of it so that we can really help expand our access to other areas that don't have, again, access to genetic counselors, especially, for example, in Reno, where there, I don't believe, is any cancer genetic counselors up there right now, or any genetic counselors for the most part in any clinic up there. So we're really trying to touch those areas, that really, really could benefit from our services and from testing and appropriate counseling.
And it's funny that you mentioned that there's no genetic counselors in Reno, in a discussion of rural and underserved communities, because I mean, Reno's the second largest community in the state. And
Yeah.
so to think that really the only community in our whole state that has genetic counselors for cancer is Las Vegas, that there's so much more opportunity to expand that and to have more counselors. And I could understand how it would be difficult to have someone working full time in Elko or someone working full time in Ely. There's just not that many people there. But I think that this telehealth option, is such a great opportunity. Now, people, when they get tested, they still have to go and do a blood draw. Is that how it
So
works?
there's different forms, there's different sample types that we are able to utilize for genetic testing, and it really just varies depending on the exact test that's being ordered. Most of my patients, for example, I do see them in clinic, and I only see adult cancer patients. And so usually I do blood draw for most of my patients because we're actually able to look a little bit more into detail of the DNA, something called RNA, with blood as well. So in my world, in cancer, I always prefer blood type, blood sample. But no, 100% there can be, saliva samples, there can be buccal swab, so cheek swab. There are a lot of different ways that we can essentially get a sample from a patient for DNA testing. And especially for those patients that we would be utilizing telehealth services for, we can just essentially send one of those cheek swabs kits or one of those saliva sample kits to their house. They can essentially just kind of swab themselves, or again, they kind of have to just spit in a tube and send it back, and they would be getting just as accurate information. So different forms of sample that can be used, not necessarily only blood that could be used with genetic testing.
Okay, so I'm gonna put on my tinfoil hat, my crime junkie podcast listener. That DNA, once they send it out for testing, it's not gonna wind up in some, criminal police database. They're not gonna use it to do that genetic genealogy to solve, the Golden State
No,
Killer.
no, not these labs. These labs are all what we kind of call CLIA and CAP certified. These genetic testing laboratories, what we use, these clinical genetic testing laboratories, right? So there's a distinction to be made between direct to consumer genetic testing. And that is essentially genetic testing that you could just go online and order a kit yourself, right? Most people know about 23andMe, Ancestry.com used to do that. There's some other websites. Frankly, there's companies that are blowing up almost on a weekly basis, showing up on a weekly basis. And these are all the direct to consumer websites. And with those forms of genetic testings, you honestly, you have no protections. I mean, anything can happen with them because a lot of times we're not really sure who's even operating those companies and where that genetic data is even being stored. Now, with actual medical genetic testing, kind of what we order in clinic, we are ordering from certain genetic or clinical genetic testing laboratories. And these are medical laboratories that are held to the same standard as essentially any form of laboratory, medical laboratory, where your blood samples get sent and for your routine blood, your CBCs, your CMPs, things along those lines. And so once these information, your genetic information gets to those labs, it usually gets de-identified, and it does get stored into some form of genetic cloud, more for research purposes. But no, that is not a concern that we have to have with these labs, just given the standards that they're held to being extremely high.
Oh, good. Okay. Tinfoil coming off. You mentioned that it's going into a database for research, clinical research, and which I think is amazing because then you can track how genetics is impacting cancer. But do you really see that this could be used in statewide research to improve kind of early detection, cancer
Yeah.
prevention statewide?
Yeah, so Nevada actually had the project, and going off. So in Reno right now, there actually isn't a genetic counselor, but they are hiring. They actually just opened up an application for one, for something that they have going on called the Healthy Nevada Project, I believe is
Mhm.
the name on the top of my head. And so that's essentially kind of what you are referencing to, is a big community health clinic project where they are performing genetic testing on individuals to ultimately help improve the outcomes of individuals kind of in the community, and understanding, how we should be doing this. Of course, again, genetic testing, we consistently right now are talking about it in the cancer setting, but it's utilized in so many different forms of medical specialties, right? It is very, very heavily used in rare disease. It's heavily used in prenatal testing, and in all forms of testing, even to the point where soon enough it's going to hopefully be used in some form of primary care testing. And so, yeah, ultimately these tests are, the data is being stored more for the purpose of improving patient outcomes and for really trying to understand what individual's genetic means. In a way, we are trying to kind of just get as much data, or they are trying to get obviously as much data as possible, so that we are better able to analyze people's DNA and truly understand what causes disease, what doesn't cause disease. A lot of the science that goes into, being able to decipher between healthy individuals, unique genetic variation, versus individuals who have actual genetic disease or conditions, and their specific genetic variants.
Yeah. It's mind-blowing. As you were talking about it, I was thinking about Star Trek and, the doctors just did that little scan and then they could find out what's wrong with you. And obviously, we have to do some sort of a body fluid, but it's almost the same thing. They can do that test and say, okay, this is probably what's going to be wrong with you. I mean, not
Yeah.
that there's anything wrong with having an illness, but so any emerging technologies or tests that you're particularly excited about?
Yeah, I mean, the technology is advancing exponentially right now. We really are starting to not only make new gene disease associations, so we are starting to, at a very rapid pace, find out new genes that cause new disease. But it's also actually our technology of the genetic testing that is improving extremely rapidly. And there is some new technology kind of coming out, a new way to kind of sequence the genes that's just going to make stuff so much more efficient. It's going to make testing so much more cost efficient. It's going to improve the diagnostic yield. We're really starting to hone in on genetic testing being a highly valuable tool for a lot of these patients that haven't, again, been able to have any answers for so long. So there's a lot of, as I mentioned, these clinical genetic testing laboratories. A lot of them focus kind of their own research on a specific kind of thing that they have that stands them apart from other individuals. For example, especially, since we're talking about cancer and we're talking about, mostly, breast cancer, Myriad Genetics. So that is a lab based out of Utah, actually out of Salt Lake City. And one of the really cool technology that they have is something called the incorporation of polygenic risk scores, or PRS scores, into determining a individual's breast cancer risk. And so what that means is that, yes, we know of these, for example, BRCA. BRCA is easiest way to think about it is a cancer fighting gene. We're able to test somebody's cancer fighting genes to see whether they have a specific genetic change that's not allowing that gene to work properly, which is what causes them to have increased risk of breast cancer, ovarian cancer, whatever it is. Now they have been able to incorporate what we call these SNPs, or single nucleotide polymorphism. So these are thousands or hundreds in specific of small DNA changes in a person's DNA that we also are starting to understand translates to what their actual breast cancer risk. So in an individual that tested, let's say, negative for all of the actual cancer fighting genes, we can still identify that they are at increased risk of breast cancer based off of other aspects of their DNA, based off of the family history, and based off of some of their other personal medical history. And so that's just one example of one lab, and really what they focus on is that PRS scores, or polygenic risk scores, more into their incorporation of who really is at increased risk of breast cancer, even if they don't have the high risk markers that we test most people for.
Just in talking about that, I'm a patient. I come in, I get my genetic testing done. You send it off to this lab in Utah, and it comes back and says, "Oh, you have a 80% risk of developing breast cancer." Talk to me a little bit about the psychosocial part of your job, the counselor part of your job, because I think that just getting that result would floor anyone. What can you do to help them understand and work through the emotional impact of that?
Unfortunately, some very devastating news that we at genetic counselors have to give people sometimes. And usually, to be honest, it really depends. There's so many different factors that really could be at play that decide how I'm able to meet a person emotionally. Are they in here in my office and we find that out in the context that their mom just passed away from breast cancer at 42? Is this a completely incidental finding that we were even expecting? Sometimes it's very context or case by case specific, but it really is just helping them understand also, and this comes to the point of informed consent before testing. We want to make sure before anybody does these form of tests, genetic testing, that they truly understand what we can learn about from this test, and be able to provide anticipatory guidance of, okay, if this does come back positive, what is this really going to look like for you? I mean, is this information that you're going to be able to really live with, right? Is this something that is going to be a weight hanging over your shoulder for your entire life? Or is this information that you truly are going to be able to accept and act on, and not have it be again a weight on your shoulder? And so that's always a big component of the pre-test counseling, is understanding where they're at and how this information would truly play into their life if it did come back positive. And after a bit more of a detailed discussion of that, of course, even though they're still okay with getting these results, and we proceed with the testing and it comes back positive for something causing, very high risk of breast cancer, it still is, of course, very devastating news. It really depends. Some people are devastated, they're floored. You'd be surprised. Sometimes some people are pretty optimistic about the situation because, they're in the situation where, whether they knew this or not, they have this, and at least now we can act on this for them. We can implement certain things moving forward for them so that that cancer is not going to be something that they develop, or at minimum, something that they don't die from. Right. And so, it really is in the eyes of the beholder, but it's really just meeting them at where they're at and sometimes having to take a step away from all the medical information and more just focus on what they're feeling at that moment and kind of just focusing on that and spending some time with that aspect, again, depending on where they are in their journey with all of this.
Yeah, I would assume that some patients see this opportunity for genetic testing as empowering to be able to take control, make decisions with a lot more knowledge and information about your own physical self than you might have had before.
Of course, yeah. I mean, that's ideally what we realistically are doing this testing for, right? It's really to be able to, just as you mentioned, empower these individuals to make their own informed decisions about how to proceed with their own care. We as genetic counselors are very non-directive individuals. And what that means is that we really don't recommend one way or another when it comes to certain kind of medical management recommendations. We just are able to provide all the information as possible and try to explain very complex genetic information into layman terms so individuals truly understand what their risks are and what avenues they have when it comes to these risks and really what they can do to be proactive and preventative and things along those lines. And so, yes, in a nutshell, that is the ideal situation, is truly being able to empower a person, a family, to make their own decisions and to make it in a way that they see fit with their own life.
I just feel like healthcare clinicians should just be advocating for this because it can create so much opportunity to get ahead of healthcare problems. How can healthcare professionals and the public really advocate for better access to genetic counseling?
I would say the biggest thing is really just to learn about it. Unfortunately, there is a lack of knowledge sometimes with the actual clinical utility of genetic testing, and not just from a patient or a family perspective, but even from a provider perspective. There can be a lack of knowledge of really who needs this testing, what this testing can do. Of course, who can they send off these patients to get this testing done, right? And so I consistently try to make as many community efforts as I can to try to go out. Actually, Comprehensive Cancer sends me out to a lot of these community health clinics, again, these primary care clinics, all these point of care clinics, to let them know that I'm here, to let them know that, hey, if you have anybody coming in mentioning this family history, this personal history, send them over to me. This is how you can refer them over to me, and I will take it over from there. I will do the detailed assessments, testing, and essentially kind of take it from there. So it's really just, having these individuals be more aware about it, and for us to at least be able to try to create more community awareness about genetic testing and genetic knowledge. That's a huge, huge component of GCAN, or Genetic Counselors Association of Nevada, the association that we form, is ultimately trying to keep pushing out that knowledge of how genetic counselors can benefit these practices, these providers, why it's important for these big community centers, these big hospitals to hire more genetic counselors, so that they can be starting to get incorporated into their own hospital system care. So mainly just, knowledge. That's really what's going to help push, I think, these services and for us to expand our workforce and bring more genetic counselors to the state so that more patients are going to be able to get this testing done and in a quicker time.
I actually couldn't agree with you more. And as you were talking, it occurred to me that we actually have this cancer plan. So the Nevada Cancer Coalition puts together a 5-year strategic plan for our entire state called the Nevada Cancer Plan. And we have these objectives written into the plan specific to genetics. So educating Nevadans on the importance of understanding family history of cancer, educating healthcare professionals on the importance of collecting family history and how it can be used, and then really increasing access to genetic counseling. These are all things that we wrote into that plan, and so I'm glad that we have you in our community championing this. You have so much passion and so much knowledge about this. What drew you to this field, and really what keeps you motivated?
And really quickly, just to, genetic testing is usually clinically indicated, at least in cancer, based off of criteria made by NCCN, which is the National Comprehensive Cancer Network. And they actually state that 1 in 4 Americans actually qualify or meet criteria for genetic testing, for cancer testing. And so when we're talking about the whole population of the US, that is a lot of individuals who have personal or family histories that really make them clinically indicated to get this testing that probably most likely are not getting this testing. And so, that's to bridge to the next point, that's one of the big passions that I really like the rewarding feeling of being able to work with individuals, with families, with other healthcare providers, doctors, advanced practice providers, APRNs, PAs, everything along those lines to really try to help bridge again genetics, genetic testing, genetic results into these patients' care to really provide better outcomes. I was always very, very drawn into the actual field of medicine, the field of genetics, especially in medicine, especially with how fast and advanced it's growing. And I really like the aspect of being able to work with these families and patients and walk them through specifically very difficult times, unfortunately, that a lot of these patients are going through when it comes to cancer. And really being able to, again, discuss complex information in a way that they truly understand and can truly make an informed decision about their own care. So it's really a huge rewarding feeling to be able to work with these families and to see the impact that genetic testing has on these individuals, has on the entire community in really improving these outcomes.
So, if listeners take away one message from this conversation, what would you want it to be?
Ask your doctors, ask your providers if you need genetic testing. Advocate for yourself, ask your family members, ask if there's anybody there that has specifically, at least from a cancer perspective, right? Again, it varies across all different specialties, but from a cancer perspective, ask if anybody had cancer. And then if they did, make sure that your providers are actually listening to it. And if there is enough of a history there, to make sure that you ask them to refer you to a genetic counselor. Say, hey, you know what? My family has had this cancer at a young age. I want to see whether I'm at increased risk of any of these cancers and if there's anything else I could be doing to help improve my own outcomes throughout life and lower my risk of developing these certain cancers. So really just really being an advocate for your own self, and really just asking your own providers whether you or whether they believe this is a test that could benefit them moving forward.
Awesome conversation. Thank you so much. It gives me a lot of excitement that we are building some momentum in our state for more people to get genetic testing and to be able to really look at how we can help more people catch their cancers earlier or improve their treatment. So thank you so much.
Thank you for having me. And yes, it's very exciting. And hopefully we can, continue advancing in this field and really start making this kind of standard of care for most people around this town. So yes, I appreciate you again having me on and always appreciate talking about this topic.
Thank you for joining us for this episode of Cancer Talks. Learn more about us at nevadacancercoalition.org and catch more episodes of this podcast on our Substack or wherever you get your podcasts.